Okay, so welcome everyone. Thank you for coming along to our workshop today on supporting our children with eating difficulties. My name's Dr. Annie Bryant. I'm a clinical psychologist working in the Psychology in Schools team, which is part of the local Mental Health Trust, Norfolk and Suffolk Foundation Trust, or NSFT. And I'll hand over to my colleague Emily to introduce herself.
Hi, my name's Emily Misen. I'm an assistant psychologist. I work with Annie predominantly in the under 18 wellbeing team, also within NSFT.
Thank you, Emily. Brilliant. So, overview of what we're going to cover today. So we're covering understanding childhood eating difficulties. We're going to talk about how we can help our children with eating, and then some information about when do we need to seek specialist help as well. And just to say, today's going to be quite a broad session. Eating difficulties can happen for many different reasons, and so the help and support that children might need can be very varied as well. So today is very much an introduction to some ideas. Hopefully we'll give you some useful ideas, and there will be plenty of signposting and resources at the end as well if you want to seek some more support. So we wanted to start by getting an idea from everyone who's here. What is it that you are worried about with your child's eating? So as I said, eating difficulties are really varied. Different children struggle with different things. So what is it that you're concerned about? And this will really help us think about what we need to sort of spend the most time on today. Lack of nutrients. Okay, so wondering about sort of not eating enough there. Panics with trying something new. Again, a lack of nutrition, so maybe not eating enough. Purging. Okay. What to do for the best. Yeah, so feeling like you're not knowing what to do. Eating too much. ADHD, impulsiveness. Yeah, that's a really good example. Starvation followed by binge eating. Sensory issues with ASD. Okay. Very picky. Not eating new things. Refusal to eat. Only eating high sugar. Worried not getting enough calories, very restricted, won't touch new things. ARFID, okay. So we're not going to be talking about specific eating disorders today, but lots of the issues that you're coming up with, we will be talking about. So that's really helpful. My daughter, who's 10, gets worried or upset when she feels sick, retches, and then wants to avoid eating. Months of being okay, then happens for a week or so. Okay, interesting. Sensory issues, beige diet. Okay, so a really varied range there. So we've got some under eating and worries about the implications of that. We've got some overeating, some sort of sensory or neurodivergent related difficulties. Okay, that's really helpful, everyone. Thank you. And we'll try and keep that in mind and refer back to some of those examples as we go through. So following on from that, we wanted to think, how does this affect you as a family? So the difficulties that you've talked about so far, what's the impact on perhaps yourself, the whole family, siblings? Cooking more than one meal, yeah, so having to cater to different eating, creating stress, making meal times unpleasant, yeah, absolutely. We're going to talk about meal times today. The other children thinking I give in too easy. Yeah, that's a really tricky one. So the impact on the other siblings. So there's a bit here about what other people might think, whether it's siblings or wider family. Can't eat out. Yeah, that's a really common one. Meal times being really stressful. Worries. So worries as a family. Sister not very understanding. Yeah, so that's really tricky when siblings find it hard to understand. Refusal to eat because she's worried about being sick makes me anxious. Yeah, absolutely. It's really anxiety provoking. Yeah. Fear she's not getting enough. So there's a lot of fear and anxieties coming up. Yeah, a lot of stress as a family. Some of those practical impacts of not being able to go out or having to cook multiple meals. Okay, yeah, so really impactful. Across the board and in lots of different ways, and not just for one member of the family. So clearly eating difficulties is something that's affecting the family as a whole. So we're going to start by thinking about prevalence of eating difficulties. And we're going to refer to eating difficulties today rather than specific eating disorders, as I said, because it's a sort of broader and more varied term. So there's a study, a massive study, a survey called the Mental Health of Children and Young People Survey, which happens every few years. And that is a sort of questionnaire interview for lots of young people. I think it's over 2,000 young people in the country, to ask about various different mental health and well-being problems. And in the most recent one of those, in 2022, of 11 to 16-year-olds, the number or percentage of young people whose responses indicated possible eating problems, so this is not an eating disorder, but possible eating problems, it was 8.1% of boys in that age bracket and 17.8% of girls. So quite a significant number of boys and girls under the age of 16. And then 17 to 19-year-olds, it was 45.5% of boys and 75.9% of girls. So the majority of girls and almost half of boys in the 17 to 19-year-old age bracket had possible difficulties with eating. And that could have been a number of things, whether it's overeating, undereating, stress around eating, that sort of thing. Picky eating is another sort of presentation of eating. So that would be about sort of being quite fussy about foods and very selective in what foods a young person might want to eat. And the prevalence of that, we think, is around sort of 10 to 15%. So about 1 in 10 children between the ages of 2 and 5. So actually for younger children, picky eating is really common. And generally as they get older, they grow out of that picky eating, but it can be persistent and kind of carrying on being quite picky and fussy with eating. And then for actual eating disorders, it's actually really difficult to get sort of specific prevalence data because it's not something that's sort of well collected across the NHS and things. But we think around 1.25 million people in the UK have an eating disorder at the moment, and that's adults and young people. But what we do know from research is that most eating disorders develop during adolescence, so during those teenage years. Okay, so what we're trying to show here is that possible eating problems or some sort of difficulty with eating is actually really common in young people, particularly common in 17 to 19-year-olds. Picky eating, fairly common in really young people. And then the eating disorders is much more rare and much more specific. We think it's probably around 1% of children or young people who would actually meet an eating disorder diagnosis. So we'll be talking about eating difficulties as a whole. So you may have already come across the idea of an iceberg, but what we're showing here with this iceberg metaphor is that what we see in a child, so their behaviour and their eating behaviour, is only a small part of the story of what's actually happening. So we might be seeing a young person is not eating quite enough. They might be starting to eat a bit too much, eating lots of sugary food, somebody mentioned earlier, maybe refusing food or skipping meals, perhaps just being really stressed about meal times. So that's what we might see on the surface. But the reasons behind that behaviour can be really varied, and it can be quite tricky to work out for some young people. So under the surface, and we're going to go through lots of these different things one at a time, but under the surface there's lots of different things that could be going on. Could be something about the young person's biology, their genetics or their hormones impacting on their eating. Could be early childhood experiences and experiences with feeding. Could be body image or self-esteem related concerns. There might be, in the centre here, we've got a collection of emotions, so maybe feeling uncertain, feeling fearful, sad, embarrassed, and that kind of leading into feeling out of control and needing a sense of control. Might be an influence of family or relationship dynamics and situations. It could be boredom or lack of interest in food and eating. Could be worrying about the consequences of eating, so what might happen if I eat certain foods, and sensory sensitivities as well. That was something that some of you mentioned around sort of sensory avoidance of certain foods. So we're going to spend a bit of time going through each of these things that might be going on under the surface. And then I will hand over to Emily, who's going to have a think with us about what we might be able to do to help our young people. So starting with biology and early childhood. So we do know that for some young people, there can be something in their genetics, in their sort of their innate makeup, that makes their appetite control or kind of regulation of signals about hunger and being full a bit more difficult compared to other people. So there can be something just inherent in some people. It is more difficult to either know when you're full or know when you're hungry. And that can obviously have impacts on eating. And hormones can change with that as well. So through kind of puberty and changes in hormones, that can impact on our understanding of those hormones in our body that are trying to signal to us when we need to eat. There's also an important role of a thing called interoception, which is a sense. It's a sense of how our body feels on the inside. So it's part of our sensory system. And for some people, so maybe people with sensory sensitivities or some neurodivergent young people, that understanding of what our body feels like on the inside can be really tricky. So some young people might struggle to notice and respond to those signals of hunger that some of us might feel really comfortable with recognizing when they come up. As well as kind of biological and innate things, there's also potentially an impact of early childhood. So typically what happens when children are babies, they are eating, very, very limited number of foods, probably just milk for a period of time. And what happens is over time, they slowly try new foods and new textures, and they learn to tolerate and enjoy these new foods and textures over time. And typically, by the age of about 5, most children are able to eat and enjoy a wide range of foods and, enjoy fruit and veg and ice cream and kind of bread and everything like that, lots of different things. But for some young people, there can be disruptions to this kind of normal development of increasing food tolerance and enjoyment. So it could be that potentially some illness or hospitalization in those early years before the age of 5, that can really impact on young people's kind of tolerance of food or enjoyment of food. Medical intervention, similarly, so having surgery, particularly sort of gastro type surgery, can really impact on that sort of feeding development. Potentially developmental delay or kind of inherent sensory issues can make that typical feeding development quite tricky for some young people, and actually not enjoying a wide range of foods by the age of 5, maybe even not when they're much older. And allergies and intolerances can play a part as well. So if a young person has a particular allergy or a response to a food that they try, that could impact on how willing they are to try other things if they know that there are some foods that make them feel really poorly. So lots of things to keep in mind in early childhood. So next we're going to think about body image concerns. And this might be one that people think of quite commonly when we talk about eating difficulties in younger people. So when we say body image concerns, we mean the negatively biased view of an individual's body image impacting on how they eat, basically. So whether that is an intention of losing weight or gaining weight or just looking different based on a quite negative view of how that young person currently looks. And there's a big role here of social media for young people. So that kind of exposure to what we think of as an ideal body image. And on social media, potentially some really unattainable body image sort of aspirations for young people without much of an understanding of kind of what level of health or unhealthy decisions those people are making to make their bodies look a certain way. And kind of linking into that can be misinformation about food and diet. So young people, particularly adolescents, are kind of really keen and interested in what their peers are doing and what other people are doing. So if they're hearing misinformation about, oh, if you don't eat today, then you're going to look really brilliant by the end of the week. Or if you eat this certain thing, you're going to bulk up and look really muscly. So that misinformation can be really difficult for young people to try and work out what's real, what makes sense, and what's a healthy way to feed my body. Culture also really influences what we think is ideal. So in Western culture, kind of previously in the sort of 90s and noughties, a very, very thin supermodel, gaunt looking was the sort of ideal for a while. And now that's changed to more of a sort of hourglass figure. So what we consider ideal, and that kind of comparison that young people are making to their own bodies, is really influenced by what's in the culture at the time. There's a really interesting study that was done in Fiji, where it was before Western TV had been introduced to Fiji, and they did a study of a small rural community of the teenage girls living in that community. And after the introduction of Western TV, so watching kind of American TV shows and things like that, the body satisfaction and kind of body positivity of those teenage girls significantly reduced after being exposed to those kind of Western ideals. So what we think of as ideal is changing all the time and really influenced by the media that we consume. For young people, what we think is ideal or what we think about ourselves and our bodies is also really influenced by what our peers think of us. So sadly, some young people might suffer bullying at school for maybe being a certain shape, a certain size, having a particular hair colour. Bullies can be really, really nasty and pick on all sorts of appearance type things that make young people kind of feel really self-conscious about things that we as kind of parents and supporters of young people would think are wonderful aspects of them. There's something interesting as well about changing body shape. So when young people go into puberty or into sort of teenage years, their bodies might be changing in a way that they feel is quite unexpected and for some quite uncomfortable and confusing. And that can lead to some of these concerns about wanting to change their body shape in potentially quite an unhealthy way. And what we wanted to point out here is that body image concerns and related sort of disordered eating is very much a problem for both girls and boys. So interestingly, lots of you here were saying that you have boys who you're coming here to sort of learn a bit about supporting. And we can kind of misinterpret and think that it's just girls, sort of teenage girls, who worry about their body image. But actually, lots of young boys are having some of the same concerns. And for example, in things like weightlifting and bodybuilding, you've actually got quite a high proportion of those sort of athletes who are doing weightlifting and bodybuilding who actually would meet criteria for an eating disorder. So that similar kind of real extremes of kind of putting your body through something that's actually really quite unhealthy, and that idea of young men or young boys kind of aspiring to a quite unachievable body shape can mean that they're impacted in terms of their eating in an unhealthy way. So we're going to move on to thinking a little bit about meal time. So what is challenging about meal times in your family? Getting him to eat, yeah. Okay, so a struggle to get your child to eat. Yeah, dealing with a refusal to eat. Greed, so that being maybe the reverse of a young person eating a bit too much or taking more than their fair share. Others getting cross because he doesn't sit at the table with us. Yeah, really nice point. Large family, yeah. Lots of clubs, so meal times vary. Yeah, that can make things tricky. Not eating enough and then complaining about being hungry later. Yeah, cooking different meals for different people. Yeah, that's really, really tiring and difficult to navigate. Eating together, staying focused and running off. Yeah, okay. Refusal on trying new things, not getting regulated times to eat. Okay, yeah. Smells, so that's suggesting a young person being quite sensitive to smells. When she throws her food or her bowl, yeah, okay, so slightly younger child there, so sort of getting a sense of distress or refusal or anger around that. Ensuring balanced meals due to sensory issues, yeah. Cooking different meals and then crying because they're hungry, yeah. Crying about the smells of siblings' food. Lots of sensitivity to smell here, yeah. Complete disinterest, yeah, absolutely. We're going to come on to that in a bit. Okay, thank you, that's really helpful. So you've talked a bit there about some of the impact of your young person's eating difficulties on the rest of the family, and we talked about that at the beginning as well. In terms of the impact on siblings, when one sibling's struggling with food, the impact of having to cook different meals or potentially not eat together when you'd like to, or having to eat together when you maybe wouldn't want to. So there's lots of impacts of eating difficulties. But what we wanted to recognise here is that for our young people, the family and relationship situations around them, whether it's friendships or things like that, can also have an impact on food and eating. So there might be a family or sort of friendship narrative or traditions around food and eating. So perhaps if a family's way of celebrating is to always have a big meal and lots of indulgent food, if a young person doesn't really like that or finds that overwhelming, they might start to kind of fear food or try and avoid it. Similarly, we do know that if a parent has an eating disorder, then their child is more likely to struggle with an eating disorder. And that's not to put any sort of blame on that parent. It's just that when a child grows up in an environment where they're perhaps experiencing a parent having their own difficulties with eating or their own avoidance of food or fear around certain foods, that can really be learned by children, and they can learn to have some of the same worries and associations. So family behaviour and eating behaviour are really, really closely linked together. And particularly when children get to sort of teenage years, they're starting to balance being more autonomous and kind of doing their own thing and maybe being a bit more led by their peers and what their peers are doing, but still that dependence on family to be fed, to be provided meals at meal times. And that can make things really tricky, because if a teenager's starting to not want to engage in family meal times in the way they used to, that can make it really tricky as a family. So we just wanted to point out that there can be an influence of kind of the family setup or friendships around a young person that sort of give them ideas or teach them kind of ways of thinking about food and eating. And once there is a difficulty with eating in a family, just the stress and kind of and issues that can cause as a whole family and managing meal times and just managing in general. And I suppose we want to recognise here as well how stressful it is for parents trying to support children who are struggling with eating, because it's an inherent drive, isn't it, to feed your child, to make sure they are well and that they've got everything that they need to kind of cope with the world and to feel healthy. And when that's not happening, that can feel really, really stressful. It can feel like maybe you're out of control or feel like things aren't going the way that you want to. So it is really stressful. So sense of control is also something that can cause or can be sort of related to eating difficulties with young people. So in the iceberg idea that we had at the beginning, there were lots of different potential emotions that might be going on under the surface. So if a young person's feeling anxious, or they're feeling self-conscious, or they're feeling embarrassed or angry or sad, when the world feels out of control or anxiety provoking, young people might try and establish a sense of control where they can in their life. So if their life feels out of control and overwhelming, whether it's due to bullying or finding school difficult, just feeling overwhelmed, often food can be the one thing that young people feel that they have got some control over. And so that anxiety or that stress might be manifesting in trying to have some control over eating, whether that is eating too much, so that sort of emotional eating of lots of junk food, or not eating enough. So sometimes you find young people who are feeling really overwhelmed and stressed, and when they feel like that, they just don't want to eat. And that obviously creates a lot of stress as a family. And we do have some specific workshops on anxiety and low mood and various other mental health topics, which we will signpost to at the end. But if you think that some of these sort of mental health difficulties might be playing a role for your young person and their eating, then we'd really encourage you to have a look at some of those workshops as well. So moving on to another reason why a young person might struggle with eating, and I think at least a couple of you had mentioned similar things to this, is a lack of interest in food and eating. And this may be because of a young person just simply not really enjoying food very much or not being very interested. Or it could be that that young person is really quite hyperactive and just so interested in other things that sitting down and eating a meal feels really boring compared to all the other fun things that they want to do. So it might be that your child is quite easily distracted, really sort of hyperactive or focused on other things. Maybe that poor interoceptive awareness, so that difficulty in understanding when it is that they're hungry and need to eat, or just simply having a low hunger drive. These can all impact on a young person not quite eating enough, or perhaps just not being able to sort of sit and eat at a meal time in the way that you might like them to. And then sensory avoidance. So another massive reason why young people might struggle with food. And lots of you had mentioned some of those sensory difficulties. So this is about avoiding certain foods based on the sensory aspect of that food. So a lot of you were mentioning smells, so not wanting to be around certain smells of certain foods. It can also be temperature or taste or appearance or texture of certain foods that can mean young people avoid them. Might be that young people just only want to eat beige food. I think somebody mentioned that earlier, or only want to eat foods that are quite kind of liquid in texture rather than kind of chunky or crunchy, not liking those sorts of textures. See some people, some young people who have something we call an aversive response to oral surprise. And what that means is finding it really overwhelming when a food is not how they expect. So you put something into your mouth, you put food into your mouth, and it's not the texture or the taste or the temperature that you expect. For some young people, that is totally horrifying. And that can lead to avoidance because they want to avoid something being unexpected. These sort of sensory difficulties you quite often see with neurodivergent young people, so perhaps young people on the autism spectrum, but also lots of young people just have sort of sensory sensitivities to food. Some might even be so specific that they will only eat certain foods by a certain brand that's in the same packaging all the time. And that can make it really tricky as a family to try and coordinate feeding a whole family when one young person's quite limited based on their sensory needs. So related to this, we've got a slightly strange question. So how much would you have to be paid to eat a tarantula? So what do you think? If somebody said you've got to eat a tarantula for lunch, what would you say? Nothing. Okay, so we've got someone pretty brave. Anyone else?
Is it that though, or is it you couldn't pay me enough to eat a tarantula?
That's true. Wouldn't do it. Is it alive or dead? Okay, let's say it's alive. Thousands. It's a live, raw tarantula. If cooked, nothing. Okay, alcohol, have to be paid in alcohol, I'm guessing, unless it's a tarantula cocktail. You can't pay me nothing to eat a tarantula. Yeah, okay, never going to happen. All right. If it paid off the mortgage, yeah, that's a good one, actually. Yeah, okay. So overall, no one's jumping at the idea of having a tarantula. We're all, I'd have to be starving, wouldn't do it. Yeah, so some people saying absolutely not. Thank you, that's really helpful. So what we're pointing out there is that to some children, trying a new food or a food that they usually avoid, it can feel like an I'm a celebrity jungle trial. It can feel like someone is saying to them, just have a tarantula for lunch. Come on, you know, you used to have it all the time, you can have it. And I think when we think about things in that way, it can help us to make a bit more sense of maybe when a young person is presenting as extremely anxious or really fearful or even revolted by a food, they might be retching, they might be experiencing that food like an I'm a celebrity trial and thinking that it's absolutely horrifying that you would even ask them to eat it. So we're just trying to explain some of that kind of sensory avoidance and how distressing it can be for some young people when they're asked to eat something that they really, really despise. Okay, so the last thing before I'm going to hand over to Emily is a final aspect of why some young people might struggle to eat enough or eat appropriate types of food. And this is around concern about consequences of eating. So this might be young people who have specific fears of maybe vomiting, fears of choking, fears of just discomfort of kind of food in their mouth or in their throat or in their stomach. It might be that some young people have a traumatic association with certain foods, whether that's a traumatic association with vomiting in the past, with maybe an allergy response, or related to like I said earlier, about maybe an early surgery or something like that. It can mean that young people are really, really fearful of wanting to eat because it reminds them of something really horrific that's happened in the past. And you can also have something that's called food neophobia, which means just a really strong phobia of anything that's new. So that foods that are not within your young person's kind of window of tolerance, what they feel is acceptable. So it can be that the young person, it just doesn't even want to try a food because of these worries about what might happen afterwards. So I will hand over to Emily, who's going to talk us through what we can do.
Thanks, Annie. Okay, yeah, so like Annie said, we're going to talk a little bit about what can you do to support your child or young person with their eating difficulties. So we split it into a few sections. So the first thing, we're going to think about what you can do to kind of develop good habits around food and eating to try to prevent eating difficulties from occurring. Obviously, for some of you, you're already at a place where there are eating difficulties, but we still think it's helpful to think about some of those things that you can do at a really basic level. We're then going to go on to thinking about developing a shared understanding with your young person about their eating difficulties. We'll then think a little bit about managing meal times. Obviously, this will vary a lot depending on your particular child and their difficulties, but we will give some general pointers in that thing. Then we're going to think a little bit about the red flags for kind of eating disorders, and then moving on to think about when you need to get further help and how you can go about doing that. So just to start off this section, it would be really helpful to know, is there anything that you've done currently that you found helpful in supporting your child's eating difficulties? So we appreciate you're probably not completely there yet, or you wouldn't be at this workshop, but sometimes there might be some things that you think, oh, actually, it did help a little bit when I did that, or that seemed to make a bit of a difference. So it'll just be really interesting to hear anything that you've found so far that has been at all helpful. Okay, let them just have the beige foods. Okay, fair enough. Bribery. Some people saying nothing's worked. Yeah, and that's really tough, isn't it? Not making too much of an issue about it. Yeah, absolutely. We will talk a little bit about that kind of thing. Letting them just eat safe foods. Lowering standards and expectations. Absolutely. Sometimes it can be difficult to kind of accept that, but actually, if you know that they're eating enough, that their basic nutritional needs are being met, then sometimes that has to be enough for now. Not pressuring the child to sit with family for meals all the time. Yeah, absolutely. And I think, again, we do go on and talk a little bit about family meal times and that being a positive thing, but we do appreciate that for some children, particularly if there is more of a kind of either lack of interest or a sensory aspect of food, difficulties, then actually not sitting with the family can make things easier. Giving in, not creating confrontation, it's a losing battle. Yeah, sorry to hear that, but not having that confrontation can be helpful. Letting eat in front of TV or screen as then they'll eat, and someone else saying, yeah, using iPad. Daughter goes through phases, avoiding food for fear of being sick. Okay, not making an issue whilst offering reassurance is best thing. Yeah, absolutely. If you get in a flap and make a big thing out of it, that makes it worse. And absolutely, and that is, we will, yeah, absolutely. The calmer and less confrontational that things can be, the better the response is likely to be, and also the less stressful it's likely to be for all of you as a family. This is one person still typing. Oh wait, here we've got it. Trying and finding a meal that can be adapted for all family members. Yeah, brilliant. Yeah, absolutely. So things that you can do so that you're not having completely different things, but that there is still kind of ability to make sure that that's within your child's kind of tolerance and that they are having something brilliant. Okay, thank you for sharing those. That's really helpful. And some of you might find that there's ideas within that you might want to try as well. Okay, so the first thing is just thinking about developing these good habits around meals and eating, and how to hopefully prevent eating difficulties from getting worse. Just when thinking about all of this sort of thing, as a priority, make sure that you're looking after yourself. So there's an aeroplane analogy. So you have to put on your own oxygen mask before you put on the oxygen masks of anyone you're with if you're traveling. That's what the air stewards always say, to put on your own oxygen mask first. And the same applies here. So you have to look after yourself in order to be able to support your child. So if you need support or advice or help for yourself in managing their needs and things like that, then make sure that you are seeking that help, because looking after yourself is so important. Okay, the next one, I feel like, so we've said prioritize family meal times for food and conversation. I'm really hearing from lots of you that doesn't work for you, and that's okay. Like I say, when we were creating this workshop, we were very much thinking about the really broad range of eating difficulties that you might see. And if, for instance, you've got a child with a more kind of anorexia type presentation, then family meal times are really important. But we do also appreciate that if you've got a child who's got a lot of sensory sensitivities or something, then actually being in that family mealtime environment can be really challenging. So whilst we do encourage this, we also really recommend that you do what you know works for you and for your child. And actually, if something that we say you think, well, I've tried that and that absolutely did not work, then don't change that just because of what we're suggesting. You know your own child the best. The third thing is really about modeling balance and being aware of your own use of language and your own behavior around food. So this can be really tricky. I think, like those figures that Annie shared earlier, an awful lot of women in Western cultures have some issues around diet and eating and feeling that we're eating too much, or talking about being naughty when we're eating a particular type of food. That's all really common. And we're absolutely not blaming people for doing that, because it very much does become part of our kind of culture and, the norms in our society. But it's really important that we're aware of how much children will pick up on of what we say. So if we're talking about, being naughty, if we're eating a particular type of food, or we're kind of demonizing certain types of food, children can pick up on it. So it's just really important to be aware of that and to try not to pass these things on to your children, I guess, essentially. So it's also about what you do and not just what you say. So if your child always sees that you're eating salads and nothing else, they may well pick up on that. And that's not to say that that you can't, as an adult, be on a diet if you need to lose weight or something, but thinking about how you're managing that in front of your children can be really important. Okay.
I just wanted to mention there as well, Emily, in terms of the use of language, I think also what can be quite nice is when young people struggle with tolerating sort of new foods or foods that feel quite uncomfortable to them as a sensory sort of perspective, it's rather than focusing on what they can't eat, but the kind of praising them and using the positive language when they are successful in trying something new. Absolutely. Or when they do tolerate something that was cooked, a little bit more than they would like, or a slightly different texture, and using the language as sort of bravery and achievement and positives, and trying to focus a bit less on what they haven't managed to eat, because we know that when children receive praise, that's what they thrive off and that's what they learn from.
Absolutely. Thanks, Sunny. Okay, so the next thing that we feel like is really helpful is developing a shared understanding of the eating difficulties that your child has. So like we've discussed during this so far, there's so many different causes for eating difficulties. And sometimes it can be quite easy to assume that your child's not eating something for a particular reason, or that they're avoiding food for something, but actually there might be something different behind it. And this is really about talking with your child about it. So the first point on here is about striking while the iron is cold. So that's about thinking about the best time to have this conversation. So what you don't want to do is have a conversation about what they're will and won't eat and what's difficult about it immediately before a meal or during a meal or at a time when their emotions are already likely to be heightened, because that's just not going to work. It's not going to be an effective conversation, and it's probably going to make them more distressed. So it's really important to pick your time. So choose to have this conversation at a time when it's quite low pressure, where there's nothing, it's not just before a meal, so you're not going to be getting them upset and then saying, right, now eat this. So pick your moment, essentially. And this is really about working out together about what is underneath the surface of that iceberg. So if you think back to that slide that Annie shared earlier with the actual mealtime distress and things being on the top of the iceberg, but all those possible reasons underneath, this is really about sitting down with them and trying to work out what is underneath the surface. So what do they find really difficult and why, I guess? And then thinking with them about what do they find helpful, because sometimes children will really surprise us and they'll be more insightful than we expect them to be, and they might actually be able to say, actually, when you go on about this, or when you're trying to push me to eat that, that's really unhelpful, or actually, when you let me sit in front of the TV and eat and I'm distracted, that's really helpful. So sometimes your child will have a sense of what is helpful for them and what is not helpful for them. Sometimes it might be a case of you suggesting things and them saying if they want to try that or think that might be helpful. So there's lots of different ways to do this, but it's really important that this is a really collaborative process so that you can really think with them, because if we start making assumptions about what the difficulties are or what's going to be helpful, we risk getting it wrong and making things worse, essentially. What I would say, though, is it's really important for you to consider before this conversation what your kind of non-negotiables are. So, for instance, if you say what would be helpful, and your child says for you to never make me eat anything again, that's not going to be something that can realistically happen. Okay, so you kind of have to think about where your lines in the sand are before starting this conversation. So thinking about what are you willing to accept and to tolerate and to kind of manage for now, bearing in mind that things might still change in the future. It's not that you set down these things and that's the same forever, but at this point, what can you accept? What's the kind of minimum, or what are you hoping for, but also what's the minimum that is okay, and really deciding on those things in advance, so that if your child does come out with something that is just not possible, you're very clear that actually no, that's not okay, and the reasons why that's not okay as well. So developing this shared understanding can be a really good first step of trying to think about how to then move forward and tackle things. Because if you've got that basic shared knowledge, then that gives you a really good foundation to start from. We're going to think a little bit next about how to manage meal times. The first point here is this is about using your shared understanding. So thinking together about what would make meal times easier or more tolerable for a child. Now, this is one where we really appreciate that the advice is going to be really different for different eating difficulties, and that the intervention that you're going to be, or what you're trying to be doing at meal times, will depend on what is underneath that iceberg, what the driver is for your child's eating difficulties. So there's a few suggestions on here. Firstly, about trying to have time with family as a family at meal times. But as we've said, we do appreciate that for some young people, this isn't going to work, particularly if there are very kind of sensory driven difficulties with food. So several of you spoke about a really strong sense of smell and a real disgust at smelling other people's food. And actually, in that case, maybe you're just going to be putting more pressure in by making them sit with the others. So we appreciate that, you do have to use your judgment here. For everyone, though, would really encourage to keep the environment as calm as possible, and avoiding applying pressure. So, like we've said, if you've developed your shared understanding, you've come up with what are your negotiable and non-negotiable things, then as long as they're doing what you've kind of, your minimums, then they're not crossing the non-negotiable lines, then trying to keep things really, really calm and unpressured. Firstly, because it will help with their anxiety levels, but also they might go on to surprise you. If they're in an unpressured environment, sometimes children will go and do something that we're not expecting. So you might have, put out some kind of food that you're not really expecting them to eat, but actually if they're feeling really calm and they're quite relaxed and they're quite kind of, feeling quite chilled, then they might try it. You never know. So that's something, regardless of what your child's eating difficulties are, you want that really calm environment at meal times. And conversation at meal times is really important. Keeping it neutral. Don't talk about the food all the time. Don't be having conversations about what they're eating and what they're not eating and the food itself. Try and have conversations about things that are more neutral. Sometimes young people find it helpful to have some kind of distraction whilst they're eating. So I used to work in inpatient adolescent eating disorders, and we used to do lots of kind of word games and things like that at the table to kind of distract from the actual eating, and that can be really helpful for children regardless of what their kind of eating difficulty is. Something to distract from the actual sitting eating can be really helpful, and that fits in with what some of you have previously said about watching in front of TV or iPad. All of those things, just distractions. So that's really helpful to think about, and whether you do that by a technology thing or whether it's around conversation or games or whatever. In terms of more specific advice, this is going to really vary. There is some specific advice on the next slide for particular kinds of presentations. But for instance, if your child is struggling with kind of introducing new foods, if they've got a very limited diet, it might be about thinking about introducing things slowly, considering any sensory difficulties they might have, and different types of food that might fit in or just outside, but in an acceptable way of the things that they're already eating. So trying to find something that is similar enough to what they're already eating that they might find it tolerable. If it's that your child is struggling to kind of pay attention, or they're just not very interested in food, then maybe trying to find ways of making meal times more fun and engaging for them. So it was really difficult to do this because we're really aware of how different presentations we would kind of manage differently, but this is just some really kind of broad general pointers. And on the next slide, if we go to that now, Annie. So this is just a screenshot of a website that we would really, really recommend. So it's from another NHS trust, and it's on understanding children's eating. This isn't information for if you're worried that your child has sort of an eating disorder like anorexia or bulimia or something. This isn't so helpful. But if you're feeling like any of those last few things that Annie covered, so the sensory element, the lack of interest, the fear of consequences, if your child is struggling with anything like that, this website has got some really good advice. So you can see a few of the bits at the top that's kind of about why children might struggle to eat and understanding it, and some of the related physical things. And then they've got lots and lots of ideas and strategies to support change below, thinking really about kind of these children who are either very fussy or have strong sensory difficulties relating to food. But they've got lots and lots of ideas. So I would really recommend, if that's the type of eating difficulties that you're struggling with, this website has got a lot of really helpful links. You will be sent a copy of these slides, and that is a clicky hyperlink that you can click on at the side there to access that. So yeah, we would really recommend that if that's the kind of eating difficulties that your child is struggling with. Okay, so this is just a quick slide about the red flags for eating disorder. So it sounded from what most of you were saying that it was more that kind of sensory and kind of lack of interest and picky eating. But I think there were some people in there who were potentially talking about what we would consider more eating disorder things. So I know that someone had mentioned purging, for example. So we do want to run through these red flags quickly. And this is just about really being aware and noticing what warning signs might be for eating disorders in your child. So we've split them into physical and sort of emotional behavioural. So in the physical, changes in weight, this can be increase or reduction, and it can also be yo-yoing. Particularly, I know that someone talked about their child eating a lot and then eating nothing and then a lot and so on. Other physical things that you might notice: them feeling really exhausted, feeling cold, dizziness or feeling faint, periods becoming irregular or stopping if it's in a girl who has started periods, obviously, nausea or vomiting, and also dental problems, which can be linked if a child is purging a lot. So purging is intentionally being sick after eating. Then sometimes dental problems start to emerge. So they're kind of some of the physical things to be on the lookout for. In terms of the more emotional behavioural, a preoccupation with food or weight or dieting, extreme concern about body image. Again, this is a really difficult one because I think particularly in adolescence, an awful lot of people have concern about body image. But I guess it's about your judgment as a parent and your intuition about whether this seems to be, more extreme than you would kind of think is typical. Excessive exercising or activity. Within that, I would say that activity can be broader. So it might not be that they're running laps. It might just be that you're noticing that they're constantly kind of twitching or doing leg exercises underneath the table or hovering over chairs rather than actually sitting down on a chair properly. All of those things can be kind of things that people can do to kind of use extra calories and things. New rituals around food. So again, it sounds from what you've said like quite a lot of your young people will have certain rituals around food. Anyway, I guess it's about watching out for things changing or for new rituals. So if they suddenly start wanting to weigh everything, or they suddenly start tearing everything up into little pieces and doing lots of moving the food around on the plate rather than eating it, that can be a warning sign. Also changes in diet, so cutting out complete food groups. So say they decide that they don't want to eat carbohydrates anymore or something, or switching to kind of lower calorie foods all the time. Also wanting to eat alone or avoiding eating with others. Again, if they're wanting to do that in the context of kind of sensory difficulties and finding smells of other people's food really objectionable, that's kind of one thing. If it's more that they're just suddenly saying that they'll eat in their room all the time, or they're avoiding eating with others, or they're saying that they've already eaten and things, I guess particularly more with adolescents, that's something just to kind of keep an eye on. And ditto if you've got skipping meals. Going to the toilet after meals if you're noticing that's happening regularly, that can be a sign that they might be going to the toilet to purge after meals. In terms of people overeating and binge eating, if you're missing food or finding lots of sort of discarded wrappers around, that can be a sign of that. And also just if they're very controlling and anxious at meal times. Again, I would say that these are probably more about if they're changes in behaviour. So if your young person is routinely quite anxious around eating, don't suddenly assume that there's something, that there's an eating disorder or something going on, because we've mentioned that. This is more about changes in behaviour that you notice. And if there's lots of these sort of, so one on its own probably isn't anything, but if you're noticing lots of these, and particularly if it's in both the physical and the emotional behavioural, that's probably, a real sign that you probably do need to get some further help. So yeah, just some kind of red flags to be aware of.
And I suppose this also speaks to using that shared understanding, doesn't it, Emily, of if you're noticing a couple of these things in your young person, that's not to say they've got an eating disorder. That's just a kind of warning flag to maybe have a conversation with your young person at a time when they're calm and just say, hey, I've noticed this. You know, what's that about? Is everything okay? And just asking them and developing that shared understanding. And if from asking them and developing a bit more of an understanding, you are then worried about their eating behaviour, then maybe that's a sign to seek some more help.
Having said that, though, it's also important to be aware that if you have got a young person who's developing an eating disorder, as in anorexia or bulimia, they might be very unwilling to talk about it, and they might deny everything. So I would say, again, it's a case of using your intuition, because even if you've spoken to them about it and they've said, oh yeah, no, everything's fine, there's nothing wrong with this, if you've still got that sense that actually this is a problem, then you might still need to seek help, even if they're saying that it's not a problem. Okay, so what to do if you are worried? So the first thing, try to talk to your child about their problems, and be curious about changes that you've noticed. Now, the BEAT website, BEAT is the eating disorder charity. On their website, they've got a really good guide for parents and family members about having this kind of conversation, which we've linked to later on in the resources, with some really helpful tips. So that's something to be aware of. Also, let your child know where they can go for support. So it might be that they don't want to talk to you, but that they're not unwilling to talk to anyone. So make sure that they're aware of where they might be able to get support. So it might be their GP, it might be the school nurse, the pastoral team at their school. There's also a BEAT helpline that anyone can phone. So make sure that they know that there are support options out there that they can access. And what you might need to do, and again, this might be something that you might need to do even if your child is not in agreement, if you really are concerned, is contacting the GP and discussing your concerns. What they can do is they can monitor your child's physical health in the meantime. So they'd always need to do kind of height and weight, and they often do blood tests and things just to check that physically there's not kind of current risk, and they can also make a referral on to the specialist eating disorder team if that's required. So they're a really important resource. Now, this is just general resources. So as I mentioned, there's the BEAT website, which is really helpful. They've got a lot of information on there, both for people with eating disorders and their loved ones. And they've also got a helpline, which is for anyone. So you as a parent can call it, or your young person can call it. It's very much for anyone. And that guide for friends and family that we've linked there is the one that I was mentioning on the previous slide. Young Minds have also got a lot of helpful information. They've got guides for young people and for parents, and they've also got a parent helpline or web chat option. So that is exclusively for parents, and that's not just for eating disorders, that's mental health in young people generally. Then there's that link that we've already talked about. And then also the PST, so PST is our team, the psychology in schools team. So our other workshops might be helpful. So we've got the anxiety workshops, which we deliver on a regular basis. And there's also, Annie has recently started doing a series of workshops on childhood neurodiversity. And there will be one coming out later this year on eating difficulties, specifically in the context of childhood neurodiversity, which might be helpful for those of you, even if your child doesn't have a diagnosis of autism or anything, that if your child has got a lot of those kind of sensory difficulties around food, that might be a helpful one. We haven't got a date for that yet, but that's our Eventbrite page, which you could, when it's available, you'll be able to book through that. And then there's also just a link to our workshop, previous recordings of workshops. And then this is just a quick slide on what help is available generally in Suffolk. So the school staff, Suffolk School Nursing have a chat health text line, which young people can text, 11 to 19-year-olds can text for confidential health advice from the school nurse. So that's available Monday to Friday in sort of school hours. There's also Cooth, which is an online counselling and support service for young people in Suffolk. That's all free. The GP, as we've said, can refer to the eating disorder team. If you're worried about your young person's mental health for something other than an eating disorder, so if it's anxiety or something, then you can make a referral to the Emotional Wellbeing Hub. There's also the Bernardo's helpline for parents, and there's the phone line there. That's the same as the phone number for the Emotional Wellbeing Hub, but if you want the helpline element of it, that's option 2. And then we've also added the link to One Life Suffolk, who offer free advice for Suffolk families on healthy lifestyles, and they've got stuff around food and nutrition. So particularly those of you who were worried about your child overeating, that might be a helpful resource, but they've got a lot of really helpful resources on there generally. So that might be something to look at. Okay, just for our information really, we've just got a couple of questions here on, have you found this workshop helpful? We are repeating it later today, so I guess the feedback that we get from this might alter what we include or don't include later on today. So yeah, there's this one, and then there's a follow-up question about what you'll take away from it. So anything in there that you've said you found particularly helpful, we'll make sure that we keep in for later, I guess. So the 2 things I'll take away from this workshop are, so we asked this partly for our use in terms of identifying what to keep in if we do a workshop again, but also because we know that if you've actually identified particular things that you'll take away, they'll be more likely to stay in your head and you're more likely to benefit from that as well. The resource slides, okay, great. Okay, good. Yeah, so that there will be an NDD workshop in this area, and staying calm. You think more information about ARFID should be included? Yeah, absolutely, and we do appreciate that. I think the difficulty with this is that we had a very broad kind of remit and people presenting with different difficulties, so it was difficult to focus too much on specific things. But yeah, I think will your workshop include a bit more about that kind of thing, Annie?
We will cover the sorts of presentations that may be associated with ARFID. So we won't cover ARFID as a specific diagnosis, but the sort of avoidance of food around sort of sensory needs and lack of interest and stuff like that, we will definitely be covering in more detail, thinking about sort of neurodivergence and how that can impact on eating behaviour.
Okay, keeping calm and speaking about food outside of meal times. Yeah, absolutely. Interesting. So the oral surprise and the food neophobia. Your child avoids eating occasionally through fear of being sick when she's anxious about other things, and you worry that it's anorexia, but this has reassured you that you don't necessarily. Okay, that's really helpful to know. Absolutely. That's really, really helpful feedback. Okay, great. More support for younger kids. Yeah, I would really recommend all of those of you who've got children who are, that website that we link to has got so much information on, and it's really helpful. So we would really recommend looking into that if it is that type of food avoidance because of sensory need type presentation. Yeah. Okay, well, thank you all very much for coming.